Hi, I'm Dr. Drew, and this is Dr. Drew After Dark. Please be advised that Dr. Drew After Dark may contain sexually oriented content and be unsuitable for young children.
Hey, welcome, Mommies. Dr. Drew After Dark. My dear friend Christina P. joins me here today. We are distancing.
Meow, meow, meow.
Meow, meow.
I'm not breathing in your ear. You're not breathing mine.
Oh,
We're doing
no.
good.
Lots of ventilation in this wonderful studio you guys have created here.
You haven't even been seeing patients, right? You're not?
Yeah, I have. Shit. Why? But I wear a mask.
COVID?
I wear a mask when I do it. No, relax. It's all good. She's worried I'm going to get COVID.
Yeah.
Yeah, there may be a ventilator in my future. There could be. I don't know. I'm going to go put myself on the front lines if they need me. So we'll see. Maybe they won't take me because I'm old enough that they won't. I don't know.
Oh goodness, I hope.
We will see. We will see. In the meantime, it's such a palate cleanser to be here with you all on After Dark. Really, I look forward to coming in here today.
I imagine, because you're all day, every day, just this drama of
shitstorm after
virus
shitstorm after shitstorm.
And to come in and talk about the real issues, like brown guys with cup tits.
Pig tits.
Pig tits. A man with a tattoo on his head.
Yes, Tom and I had a time with him, and I thought most of the time I was talking to Tom about it, I thought, I can't wait to talk to Christina about this.
That's all I've been thinking about. Next time I see you, how are we going to discuss pig tits?
Yeah.
What's going on there? Oh, the trauma is all I hear in my head.
Yeah, but it took a special turn, and immediately also, this is something innate in me. I needed to have a home visit. I need to go see. I need to visit.
See,
him.
That's the difference between you and I.
Yeah.
Is I run the other direction.
No, I want to go. It's like a cantaloupe. I want to thump it. See what's good. See what's going on.
You want to go into the heart of darkness.
I just want to go see what's going on because I know we're only seeing a slice of it.
Yeah.
And it will come, the whole thing, because I can't understand it. And so I want to understand it. And so I need the whole setting, context. I need to know what's going on.
Should we just dive into him? Because I have.
All right. Okay.
What do you want to do?
Yeah, let's do it as long as he's up on
our.
Before the calls, let's do a little. Oh, what's this?
See, he's in our hearts.
So this is his
deep
Twitter
in our hearts. So female supremacy.
Yeah. So he's just tweeting a lot of the stuff that he's into. And
he's back up on Twitter.
A lot of so what he's been doing for the last week or so is just activating, deactivating.
Should we say who this is first so that people may not be
Why don't
aware?
We show the classic video?
This
Let's
is
set it up
This
proper.
is Norman Summerton.
Yeah.
The pig tits, tit cups.
Is he a like a transgender activist sort of?
No. It's better than that.
It's better than that. It's more complicated.
Yes,
it's more complicated.
exactly.
Yeah, that's what I thought.
So can we play his clippy?
This is his original clippy, just so
second.
everyone gets a feel for this.
I will bring it. So now
I have this feeling like he's a nurse.
Wrong. You're gonna die when you know what he really does.
We
know what he does.
Oh.
He has a LinkedIn whatever. Here he is. So here's Norman.
See, I feel like he works in the medical system somewhere. That was my feeling.
Really?
Yeah, I don't know why I got that. Like he's a caretaker. Like it's
his pig Norman Summerton in his tit cups. Been in these babies for 7 hours now today. Okay. I say, look at these things, eh?
See, what Tom and I got off on was that if he were, you're taking notes?
Yeah.
If he were properly attired, you would not suspect a thing.
No, that's the whole point.
That's what's so interesting about him. And so I could see him working, like admitting or something in a nursing in a hospital.
Turns out he was a mortgage broker.
Okay.
I don't think that was real.
No, I think it was. And I think he got fired because he was exposed. And then after he got fired, he got the head tat. Because you're right, the head tat, that can be concealed.
With a hat or something, or a toupee or something. But once you go to scalp tats, that's a special zone.
What? Okay, hold on.
Because
There's
my buddy
dissect.
Jason Ellis has a wolf on his head.
Sure, I know. Ellis.
And he will always go when he talks about his own psychopathology. He goes, I have a wolf on my head. It's like, see how crazy I am?
Is that the final?
Even for him, that was like a move.
You don't. Okay, so let's go. The top of the head is crazier than, let's say, the throat.
Well, the neck,
the chest.
Okay, these things have different meanings.
I know.
So let's go. So the neck is drug addict.
You think?
Hold on.
We need to make a chart of the decoding of Dr. Drew's.
Drug addict, criminal.
Criminal.
Yeah, at least capable of criminal activity, if not hard. So this hurts. This is the most
that's what I'm
sensitive.
saying. It's tender.
Yeah. It's telling you I inflict pain, and I'll take pain.
Wow.
So
what about eyelids?
Eyelids are just sort of bizarre, right? That's sort of like wacky. Like I want to freak you out.
I want
like
to freak
tattoo
you out.
eyes on my eyelids, so you can't tell if my eyes are open or closed. But this is meth criminal. Yeah, but the chest has very
piece.
special stuff because I think it's different for men than women.
Let's separate this into two categories. I think you're right on both.
Yeah.
So let's do. I agree that in the anger department, well, maybe on both genders.
The neck, women don't do the neck, or rarely do.
Seldom.
Rarely do. Yeah.
So what is it when a woman does the neck?
Fuck you. Fuck everything.
Anger.
Yeah.
And the chest on a woman.
Now the chest is very interesting because it's usually like wings or something, or someone's name, right? Or some
and
words.
male and men.
Words.
Men, it's words.
It's let's see. Look at that.
Well, his says Miss Talon's cuckold property.
Yeah, it's a message. It's a message on your chest.
Right.
It's a message. It's a message in a bottle.
Right.
It's something you can pluck out when you open things.
But
up.
now for a woman's chest, women's breasts are mother's milk.
Yeah.
This is a very kind of a sacred place when you have children. You rest your baby. So for a woman to tat up this area, for me, has been like, wow, what's going on?
I agree, and it's sort of. All I can tell you is when I see it in a patient, I'm like, oh boy. You know what I mean?
A drug patient?
Like it just personality stuff.
Yeah, depression.
Borderline-y.
Yeah, borderline.
Trauma-y. But heading towards sociopathy kinds of stuff.
Oh,
Like, so it's
okay.
hard to reach them.
It is.
Because it's like
They're
so deep.
gone.
Not gone. Hurt.
Hurt.
Now
let's go to the top of the head.
Top of the head is sort of, it's a rare custom, right? So it's women. I've never really seen that.
Amber Rose has her forehead tattooed. She got both her children's name.
Okay.
And you know Amber Rose, she's a very beautiful model.
I know Amber very well. Amber was on my podcast a couple of times. I wanted to do Love Line with her. I thought that'd be very interesting.
She would be great.
Very interesting.
Let's try to get her.
But bring her as a guest.
I know.
Here. So, but this is like the forehead is like, you know how there's like a scroll on Times Square? It's like there's like news going by. Today the world.
Ticker tape.
Yeah, it's a ticker tape. This is the ticker tape. I'm telling you something.
Yes.
You need to read. This is news.
This is news.
News here.
Right.
Yeah. Here is see, even Amber with her bald head didn't put something on top of her head, right?
Right.
And I can't think. I'm sure there are women that have done it. I just can't think of any. And men are like telling you I'm badass.
I'm a tough guy.
Yeah, I'm tough. Okay. Even if it's a piggy on my head.
It's a piggy.
I'm not a pussy.
He is not a pussy. You'll see in a moment here. But what does wearing tit cups for 7 hours do to you medically? What
I'm imagining it's just like it elongates the tissue. Like stretches the skin primarily. See, that's the thing that I always am sort of curious about when people do things like that, because it's primarily your skin.
Skin gets stretched.
Yeah.
So he can create breasts for himself. Is that?
I think that's what he's up to.
He's up to.
I think he's up to that, but I think he particularly likes the appearance and feel when they're in the cups.
Meaning the torture, the pain.
I think that's more piggy-esque.
Imagine a pig with tits.
See? That's what turns him on.
To be suckled.
Whatever it is. No.
Oh.
That he wants to be the pig with tits.
Be the pig with tits.
Yeah, and that makes him high, makes him engaged, makes him.
This is a labyrinth. Okay,
yes.
so
that's why I want to go see. I want to go visit.
You want to know. Now here's what I'm getting stopped up on.
Okay.
He has a mistress, and he respects dominant women, the femdom, whatever.
So he likes the leather
woman telling
dominatrix.
him. Now the woman tells him, I'm guessing, to suck men's penises. So it's confusing.
Wait, she wants him to suck men's penises.
I'm not sure. So he sucks men's penis. He specifically is looking to suck men's penises. So I'm confused because usually the man that's into the dominant woman. I thought that would be a heterosexual inclination.
Yeah,
so for him to go, now here's my theory. Do you think he's actually a homosexual, but he needs permission from mommy
Mom has
to go?
I dig it.
And maybe his real mom was a real tyrant.
And also anti-gay or something. Maybe gays.
But why the interest in a dominant?
Well,
that's interesting.
Being into, as I understand, we should get a dominatrix in here to help us with this. Yeah. Being into dominatrix is not necessarily a heterosexual pastime.
It's not necessarily interesting. I didn't know
Because there's many different, like all the doggy stuff and the horsey stuff. That's all offshoots of kind of being dominated.
S&M culture.
And some of them may like being dominated by another male. Some of them may like a female, or both. It's an equal opportunity employer.
I wasn't aware that you could be a homosexual and want like a female.
I've not. Well, much like everything about Piggy, I've never seen before. I'm not really familiar with that particular. What is that? What should we call that? Arrangement?
Yeah, I don't know.
Constellation?
I don't know. But he puts.
So those
it
are the
out
women
there.
he likes, right?
He likes dominant women.
Oh, I know the woman who told me to call me today. She's his neighbor.
No.
Or lives near him. I said, please call back. Let me see if she's on our list of calls today.
Stop it.
Yes, I swear to God.
Oh my God, he
Yes.
he tweeted out our episode.
Oh,
Oh my
with Chris D'Elia.
God.
With Chris D'Elia.
Oh.
Yeah, that's where we.
When you guys were talking about
yeah,
it?
so here's the thing. I thought Norman was against this coverage because he would delete his social profiles. I thought much like King Ass Ripper, he's one of these guys that's like a real G. Like, you know what I'm saying? Like,
hang on a second.
yeah.
Why have you guys withheld King Ass Ripper from me?
We can't get a hold of him.
But I've never seen that. I've never heard that word before.
You
King
have.
Ass Ripper?
Oh, you have.
I have?
He's a glutton. He likes to eat. He's
No,
like,
I've not.
sniff this one.
No.
You've never
You
seen.
withheld him from me.
I gotta write that down.
Okay,
All right.
King Ass
But he
Ripper.
refuses to be in the spotlight. And I thought for a while Norman was of the same cloth.
No,
that
no.
He's a purist. And
Clearly
now
not.
he wants the
Well, what does he
spotlight.
say about it? Oh, he tells you exactly when to tune in.
It says, check out this podcast of The Pig. Pig's coverage begins at mark 20 minutes in and again at 2 hour and 20 minute mark.
Oh,
How
boy.
did Chris react to him?
I mean, the way we all do, which is like.
Well, not me. I'm
holy
like, want to go
shit.
visit him. I'm going to go do a home call.
I think Chris was into him too. Like, I want to have him on my podcast.
Okay, good.
He tweeted out the episode that you and Tom talked about too.
Oh my God.
Oh.
He
You will
loves
laugh
this.
your ass off, it says.
So he likes the humiliation because we.
No, he's in on it. Wow. He's in on it. My respect for him has just climbed immensely.
Dude, he's the best.
He's the best.
He lives in Calgary.
He's in on it. If we could just get our Robert Paul to get in with us fully, to understand that we embrace and love this.
To get all in. Yeah, we're on your side.
We're on your side. We're not hating on you. We're loving all of it. And
Yeah.
you are representative, with love and peace,
Mm-hmm.
of the human spectrum.
Yes, and we're curious and we want to know. I
Yes,
want to
yes.
know. I love
Now,
it.
I don't know about Tom. Tom sort of,
Tom
may
is-
laugh a little bit at you.
Oh no! Look, these aren't tit cups. These are like tit ropes. And he's putting ropes around them. Oof. Oh, and he's got a tattooed bra. Did you notice that?
Yeah, I did notice that. Wait a minute. What's he saying there?
I don't know.
Can't
Can
quite
we
read
play
it.
it?
Hashtag. He says hashtag sissy faggot.
Hello, Twitter. This is Pig Norman.
This is what I
Summerton.
understand. That's the humiliation.
I'm the
part.
own property of a superior woman. Don't want to mention her name so she can keep her anonymity private. But she has me in these banded tits today for the next 10 hours. So I got to find some use for them. Maybe one is to hold my pig hoof paws on. Wee, wee, wee. Wee, wee. Another one is to make pigs like me stupid. Having tits
What?
Make them
while
stupid.
wearing women's clothing.
Oh,
Mhm.
he likes the
Yes,
humiliation.
indeed.
There's no head tattoo there.
So
this is
for
an
the
old
next 10
video.
hours, Pig gets to suffer under her commands to wear these banded tits for her pleasure. She's a sadist. Fortunately, I'm a masochist and a pig. Wee, wee, wee.
He's great. What a treasure.
Well,
Jackpot.
bye-bye, Twitter.
I love him. I wish this guy were my dad. How much fun would Norman be if he was in your family? You'd be like, dude, Norman's coming
Norman's
for
coming.
Thanksgiving.
It's awesome.
He's wearing his tit cups.
I want to know how it came into his age. I'm imagining
All of it. Now, he says
14.
16.
Yeah, see, 14 to 16 is the magic age for males.
Meaning when they discover
They just
their
have-
fetish.
They just are all over the place.
They turn it
can't-
on.
They
Now-
know that their biology just overcomes them, and then it goes into wherever it goes, whatever's pre-existing.
Here's a
there.
question: how does one turn? Because I'm assuming the shame and the humiliation thing is a result of trauma, but how do you fetishize your shame and humiliation to like make it sexual. Do you know what I'm saying? Like
men do that with just about everything. First of all,
yeah, shame and humility.
Just anything traumatic, anything will turn, anything intense will turn into sexual. Just it happens. But we don't really know how fetishes really work. It's not really that well understood. There's all kinds of thoughts about how your brain is structured and regions that are nearby, arousal reasons and stuff that might sort of bleed in. I think fundamentally it's a wiring thing. Yeah. That when the trauma is so arousing, and so that arousal, then
that high state.
Yes.
It's such a, especially when it happens young, it's such a high level. The level of arousal.
It's shattering the regulatory capacity.
Yeah.
And then when the hormones turn on, somehow that then becomes associated with sexuality. I think it's similar in women, but yet a little different, because it usually has more reenactment in my experience to it. Like the reenactment itself is what's so
meaning
arousing.
The daddy stuff. Let's say you're molested by daddy. Is that what girls get older men? They go and they look for.
I mean that's just sort of just so, but and it's a little on point. But it's the reenactment that's more. This is. I don't know how to, it's just my sensibility of this. Again, I don't speaking for any literature or anything, and I was very cautious when I do that. But men's stuff sort of feels like it starts more masturbatory, and women's stuff starts more interpersonal. If that makes sense.
They want to find recreate the relationship dynamics of the abuse.
Yes, and the men just want orgasm about this bullshit, whatever it might be.
Fascinating.
Isn't that crazy?
I feel like the men's version is a lot healthier. Because you don't marry
it's less
abuser.
dangerous. It's less dangerous.
Like you don't
but it goes all the way to Norman.
Hey, man.
It's more creative.
Does he look traumatized? He looks pretty freaking happy.
I'm a little bit traumatized.
Yeah, we are. Yeah, he's fine.
But I want to go in. I want to know more.
I want you to go in. Now, but again, putting tit cups on, cutting the circulation off to your breasts for 10 hours, that has no tissue damage or...
I'm imagining it's not cutting the... It's hurting, right? It's like anything squeezing kind of thing. It hurts. Imagining it crushes some tissue and causes some inflammation, and maybe that's where some of the enlargement comes from. Maybe. I don't know. But I imagine you have to get some. You have to eat. You have to get fat to. It's mostly fat tissue, right? Oh, well, he likes.
Those are big Louboutins.
No, I know, but I want to make sure he's not like bug crushing or anything weird. You know what I mean? There's weird fetishes with heels. Oh my God, what's happening?
This guy's Twitter account is gold. I don't get this one at all. Like, do you understand this at all in terms of sexual...
I understand people do that.
Yeah,
I don't understand the deal.
Like, to get hit, bro, is like it's the worst.
It looks very uncomfortable.
That makes that guy jizz. He's like, oh,
again, see?
Yeah.
This is the male thing. He's not looking for a relationship with those women. He's looking for a release.
God, humans are just amazing.
You're right? Tigers don't do this.
No.
Macaques don't do this.
No. And I always look to the animal world to understand things.
This is where we are off the chart.
Yeah, but we're not that different than a monkey, right? What DNA we're like only off by
5% or something.
How is it that tiny bit leads to that?
Well, one thing, there's a whole layer in our cortex that the great apes don't have, and it's sort of an integrative layer. We have, I think, 6 or 8 layers in our cortex, and they just don't have the one that integrates all the columns.
Gotcha.
And so remember we talked about this being an integrated problem.
Oh,
right?
The communication between the two sides, right? Which is trauma. That's a problem.
Not just the two sides, but the layers and the columns, which is how cognition is sort of organized. Yeah.
We don't know anything about
Not yet, my dear. We got a lot to learn about the
world. I don't understand. These people are bored during this. I'm bored. Really? You got Norman to watch. You got to figure this shit out.
They're bored during the
fuck. Are you bored?
The quarantine?
Yeah, like I'm never bored because the life is.
I know people. You got to like people though to be interested.
Deeply interested. I do. I like people.
Me too. And so are we done with his Twitter? I think there's more to mine there.
You want to do a whole fucking episode? I mean, we could be here all day.
Well,
Pick Norman Summerton. He's got a.
It's the first time I've seen all those fancy tats around his nipples.
You never seen the starfish?
No, because they're always in cups when I've seen him.
Yeah, I mean,
The
the guy is dedicated.
What's going on down below?
I can't scroll too much more.
There's a dick there.
Yep.
He's sucking a dick.
Oh.
Now, let me ask you this, Drew, because I do think like I don't want to use the word normal, but is it quote, is it healthy when your whole identity is your sexuality, let's say? You know how people really lean into an identity?
Yeah.
I'm not saying what he's doing is, like, that's whatever, but to make it your sole thing.
But we don't know that about him, do we? So we don't know what his previous profession was.
We think he was a mortgage broker because of LinkedIn. It could be a joke.
I don't buy it. I get caretaker for some reason. I don't know why. So somebody knows something about him. Let me see if any of the callers from Calgary are here. Is there anything we can learn from the internet about him? Nadav, can you help?
I mean, yeah, we were just looking at it.
Okay, that's it.
We're learning
Okay.
everything about him right here.
Okay, well, go. But does he say, like, in there? Does it say, like, about me? Does it talk about his job or anything?
Remember that profile we did find? Native?
The LinkedIn one?
Was that LinkedIn?
Yeah.
When he was like, I'm a pig. I'm
There's an about me. Let's go to the about me.
the
about him.
Q&A thing, remember, where he answered with those questions?
Oh, in LinkedIn?
It was a Reddit, wasn't it? Nadav?
He needs to be
Yeah,
on
let me see if he's reactivated that.
And it
one
was
second.
like
Wait, let's just see about me, though, if you can. Isn't there...
Calgary callers only, no minors, Calgary cocksucker, giving free blowjobs. Only Calgary callers with caller ID will be answered.
What is the word something order of life? Natural order of life. Natural order of life. Okay. To be a pig is a natural order. Ooh, he must have gotten to... What is that? Oh, my God.
I think he just blew up on the internet. Like, the day we featured him on YMH is the day some other podcast did, I think I heard. So he got, like, just blasted. Like, he became viral.
All right, it looks like he has not reactivated his Reddit account.
Yeah, he probably got
We'll
spooked.
fish around while we're talking here and talking to callers, and you see if I just see what hints, like previous employee or it's something. I'm gonna bet something where we just go, oh, you know, nursing home director.
Yeah.
Something. I don't know why nursing home keeps popping into my head.
You see that? Yeah, you're.
Something where, and
Caregiver.
I'm gonna predict.
Yeah.
Very good at what he did.
Yeah. I think he's very intelligent.
Yeah.
I think look, you have to be smart guy to really go this deep into a fetish. This is not just the average Joe
There we go.
giving BJs, right?
Go to calls. This is Stephanie. Hi, Stephanie. What's going on, Mommy?
Hi, how are you?
We are great. What's going on there?
Okay, so I was going to tell you, just so you know, I'm from Chile, so that's why I have an accent, just get that out of the way.
You're from Chile. How did you end up in How did you end up in South Carolina?
Well, my dad, he's American,
Ah,
but I grew up there.
got it.
Yeah, but then my husband's in the Navy, so I ended up, we the government told us to live here, I guess.
All right, fair enough.
Yeah, so I was going to tell you, since I was 16 years old, I've been lactating. In Chile, they told me, like, oh, whatever, like, it's nothing. And then when I got here, they freaked out about it. And they did like every exam you can think of, an MRI. I got.
Well, let me
else,
explain.
like,
Let me explain why they freaked out. So, lactation in a male or a female. Female, it's most of the time pregnancy, right? But she's been doing it continuously since she was 16. So then you start going, this is a problem. It can be a prolactin secreting tumor in the pituitary gland. It can be hypothyroidism. It can be even sort of breast abnormalities, like even cancers rarely. But just irritation of the breast, stimulation of the breast can cause it. So if you're like, for whatever reason, you're irritating the nipples, that can cause it. What else were they looking for?
Well, they did everything. They did like blood tests, my hormones. They did everything, and everything came out normal.
Yeah.
And then they got to the point where they're like, "Well, we don't know what to do. We're gonna send you to what are they called? Sorry.
Endocrinologist. Yes.
Yeah. And then they never. I swear they never answered the phone for me to make an appointment.
Oh,
so I ended up like never making an appointment.
Oh.
And
you should. I mean, you really should, because there can be microadenomas of the pituitary gland. There can be other things that only an endocrinologist would sort of pull out. I suspect you're more in that category. You just have sensitive breasts that kind of do this. But have you ever been pregnant?
Is it bad?
It's not.
No, I had. Well, I had. So I was pregnant once. Well, I don't have any kids, but I was pregnant once, and I had a miscarriage.
Okay. It's not anything bad, but it's something that needs to be explained. They need to say, hey, it's just the irritation of the breast or whatever. We've ruled everything else out, but it needs to be completely done. So
should she try tit cups?
No
10 hours on tit cups?
Tit cups would exacerbate her problem.
Yeah.
You see.
Yeah.
And so.
But it would collect the milk. I was thinking of a kind of
Oh my God.
like a twofer.
Oh my God.
I can't believe I'm talking to you guys. I
Aw.
swear I'm a huge fan, and I listen to you guys every single week, and this is awesome.
We appreciate that.
You guys are
Well,
awesome.
I'm sorry you're lactating. It really is one of nature's cruelest things when women lactate.
That's fine. Well, my
I
husband,
hate it.
My husband,
Hated it.
he won't suck on my titties. That's for sure.
Of course. Has he tried it? Has he tasted the milk?
I don't know. Have you tried it? Yes, he said yes.
And that's something you want him to do, but he won't do it because of the fluid, right?
Yeah, he won't do it.
Well, I got to tell you, since I've breastfed 2 children, I do not want Tom sucking on my titties. I'm like, oh, it just reminds me of like
Yeah, like he's a little
breastfeeding.
baby.
Well,
Yeah,
my nipples are
ugh.
always. My nipples are
Stop
always
it.
really like irritated, you know.
Yeah,
they're
that
irritated.
I'm
Yeah.
always hurt.
Yeah, see, I'm suspecting that's what this is. But sometimes the endocrine problem that causes the lactation can cause sensitivity too.
Yeah.
So you got to rule it all out. You got to do the full workup. But you maybe your bras aren't being sort of properly fit, or you can get somebody to help you with that. So limit the irritation, okay?
Okay.
Good luck,
All
mommy.
right. So
Sounds
you're such a fan of Christina.
Thank you.
You're such a fan of Christina's. What do you like best?
Stop it.
Oh man, like her TikTok, keeping my jeans high and tight,
Thank
centering
you.
it.
Thank you.
All of it.
Thank you so much. I'm doing the Lord's work. It really is just a joy. It's not work. Do you know what I mean? I appreciate
Bringing joy to others, like you're a clergy or something.
I feel like I have to keep normalcy alive, you know.
Or whatever.
You need talks about animals and stuff.
I watch Christina's TikToks and I sort of recoil a little bit. It concerns me. I get worried.
Well, my mom just made a TikTok, and I told her you're fucking TikTarded right now. You know, like you're too old for this shit.
Yeah, I don't like making them either. I feel like it's inappropriate at my age, but I do like watching I appreciate other people.
We need to make one.
yeah.
We need to make one.
We need to make a talk?
Yeah, why not?
Do it right now. Shit.
All right. Bye, Stephanie.
Bye, Stephanie. Good luck with your
pleasure
kids.
talking to you.
Bye.
Bye-bye.
Titty cups.
Bye. Oh, goodness gracious. Lots of interesting
What is going on
calls.
in the world? That's crazy to lactate forever. I'd hate that.
Yeah, it's uncomfortable for them. Yeah. And hey, Zach, what's going on, buddy?
How's it going, Drew?
Good times.
Christina?
Hi, Jeans.
Good time, Jeans.
Big fan over here in Massachusetts.
All right.
You staying safe?
Now,
you're having a little trouble there, Massachusetts. Let me look at your numbers.
Massive, huge tits. Big problems over there.
No, they have the
I'm-
COVID.
Yeah. You got the Rona, bro. Are you staying inside?
Oh, yeah. I mean, I'm taking my dog for a walk right now. His name's Alfonso.
Yeah, hi,
Super
Alfonso.
hyped, but
What's your
Alfonso's struggling to get into my car right now.
Oh, okay. Well, what's your problem? What you got going on?
Now, I have a couple problems. One of them, which is concerning my browns.
Of course.
Go on.
Now, I probably brown. This is kind of recent, a couple weeks ago.
Mm-hmm.
Probably started to brown, probably about 6 times a day minimum.
Ooh.
Wow.
And it doesn't look very good.
What do you mean? Is it diarrhea?
Excuse me?
Is it loose?
No, it's not diarrhea. It's very loose, yeah.
Loose.
It looks like those black snake fireworks.
Ah, got it. Good description. Well done.
Black snake fireworks?
So that concerns me that the black can mean blood. You're not taking iron, are you, or anything with iron
Well,
in it?
it's not black, but it has that consistency. It looks very porous.
I'm staying with the black snakes. I get that.
Are you a writer? You've got quite a vocabulary. It's very descriptive.
There it is. It's the black
No,
snake.
I play jazz.
Wow.
All right,
yeah, you're an
let's-
artist. I
yeah.
can tell.
So, how long has this been going on?
Like a couple weeks now.
Couple weeks. And you new medication, anti-inflammatories, aspirin, anything weird?
Now, I am on gabapentin and duloxetine, but since the quarantine started, I've introduced eggs back into my diet, and I think that might have something to do with it, but I don't know if I was just, like, making stuff up.
Yeah, that doesn't sound right to me. You sure there's nothing else? New supplements? Because people are taking lots of supplements in a desperate attempt to keep this thing off. You do anything like that?
No, I'm not taking any supplements, just eating normally.
All right. Well, I would add a little bulk. That's my solution to everything. So get some, it's like Citracel or Metamucil or something, and add some bulk in and see if that doesn't slow down a little bit. And the black, if it really is black, then you got to go see somebody to get a scope and whatnot, because black means blood coming from somewhere.
It's more of a reddish hue.
And it's still kind of concerning. I mean,
Yeah.
it's brown. I worry about. Yeah.
Are you wiping and it's brown, red?
Wait, hold on. I got to get him back up here. I accidentally clicked him off. Is there red on the toilet paper, like red, or just all the brick colored?
No, it's like a light brown.
Right.
Maybe some little flecks.
You had a second problem. Christina wanted to go light on the brown today.
So my second problem. I mean, when I was put on the phone with Josh Potter for a little while, him and we kind of share this issue of it takes a very long time to ejaculate.
And?
Oh, sorry. I thought I lost your call for a second.
And is it as bad as Josh, where it never happens, or is it just, does it upset people, or you?
Josh is kind of he's like the grand poobah of this category, I will say.
Yes. He's
not
sort of
quite as bad as his.
Yeah, he's what you call a poster
He's the
child.
master.
Master, yeah.
Yeah.
No, he leads.
So
he feathers.
It's not quite that bad, but so I mean, I think it might have something to do with I dip a lot, like the chewing tobacco.
No, it's the duloxetine probably.
Duloxetine, is that an antidepressant?
Yeah.
It's
the
definitely
antidepressants do everything to everything in the sexual cycle. It can cause diminished libido, delayed ejaculation, early ejaculation, problems with sort of the relaxation phase, the detumescent phase. Any phase of sexual arousal can be messed up by antidepressants.
What about gabapentin?
Not as likely to do it, but it can.
Okay.
It can. So he's got both medicines working against him there. So
yeah, Brew, you got to lay off those if you
No.
want.
No.
Keep taking them.
Just talk to your doctor about it. Since you're wanting to be off the brown, let's just do another brown call.
Oh my God.
Jake, what's up, buddy?
The worst.
Oh my God. Hi, Gene.
Hi, mommies.
Hi, how are you, mommies? Let me walk outside. I'm at work.
What kind
how
of
are you doing today? Good?
Are you working at a grocery store? What's going on?
I work in a warehouse of this fragrance company. I'm walking outside so you can hear me.
And they're making you work.
Yes.
I mean, your jersey got hit, man. They're making you work?
Yeah.
Damn.
Oh, it's so bad. Yeah. I've been working overtime like crazy.
Oh.
Thank you. Whatever
Crazy.
you're doing.
I mean, I don't mind.
All right. Wear your mask, wash your hands, all that good stuff.
Oh, that's all. But my question. All right. So I make beautiful browns constantly. 3, sometimes 4 times a day.
Congratulations.
I did an experiment.
You've been experimenting?
Like 3 weeks ago, I went on a bender, and I had a lot of whiskey, and I woke up the next day and it was brown. I mean, blood in my brown. And then
I
the
understand.
week after, I just had beer, and there was no blood. This week, there was blood again because I added the whiskey. Is it the whiskey that's doing it?
I mean, aren't there other factors? Is he like an
I don't know.
alcoholic?
I eat like shit.
You eat like shit.
No, I only drink on.
No, he's like a binge user. He's fine. I mean,
yeah,
probably.
Right.
And he's a young man, so whatever. It's like, as long as he doesn't have consequences, we'll see. And family history and blah, blah, blah. So, again, aspirin, anti-inflammatories, anything that can make you bleed?
No, I don't take shit.
So
even if I'm sick.
So the whiskey browns are red.
I mean,
yeah, and it's scaring me. I'm like, that's not normal, right?
No, it's not normal. So blood in the stool, if it's in somebody, how old are you?
I'm 23.
23? What about hemorrhoids?
That's what it is. But blood in the stool typically is hemorrhoid, but it's not diarrhea then, right? You love this.
The word diarrhea.
Nice, solid.
It's solid.
I thought if there was hemorrhoids, it'd be something hanging out of you.
No, it can be. They can be internal. And
what?
And
worms? The poop worms?
No, not likely. So here, the likely thing is that for whatever reason, this is irritating a hemorrhoid, and the blood on the toilet paper, blood in the bright red blood in the bowl in a young person is typically
Bright red blood on the toilet paper.
Can be.
Those are roids.
Or usually hemorrhoids. You can have inflammatory bowel disease, but that's usually with diarrhea. You can have fistulas and those sorts of things, but you would have pain and those sorts of things down there. Fissures, those do bleed too, but you'd have irritation and pain. And if there's something else like an AVM, they're called, that can bleed down there.
What's an AVM?
Arterial venous malformation. Those are usually old people that get that kind of stuff, and he's not likely to have cancer or polyps. But if this continues, you do need to see a doctor. Do need to see a doctor about it. All right, let's do a little TikTok-y.
God, it stressed me out listening to you say all those things.
Why?
As a doctor, because you're like, it could be this. You could be bleeding of cancer inside of your butthole. Oh,
well, the hard part is we have to make sure we rule out serious. Our first job is to rule out serious things. That's our first job, and then it's kind of everything else. We have time to look at everything else, right? But you want to make sure.
Bananas. You just have that in your head. You just go through a Rolodex of possible tragedies.
Well, you know what's interesting is when you're a student or a resident, you're particularly in my field, you're trained to do what are called differential diagnoses, which are lists and lists and lists of all the possibilities it could possibly be. And people like me, attendings, come in and go, what else could it be? What else? Think of this. What about that? What's the literature say? What's the just getting them to think about the most obscure thing possible in addition to the more routine stuff that I just went through. Then fast forward 10 years, that stuff, it collapses into like one sort of one category in your head.
Because you've seen it so much
so
that
many
you're
times
like, there's no way it's not going to be
when you walk in the room, you can go kind of, I know which kind of zone this is in that giant list, and you start honing immediately.
Well, and also people don't disclose everything because you just don't think of it as a patient.
Right.
Like what you're asking him, like, are you taking drugs? And then someone goes, I'm not taking drugs, but I am doing heroin once every week.
Which is why you have to be very specific, especially working with drug addicts and psych patients. I learned that you have to be extremely cautious with your questioning and very specific, and usually repeat yourself 3 or 4 times to make sure you're getting. If you have a suspicion that something is going on, you must repeat the questions. And so in terms of this, when you're resident, things collapse into one category. Then rather than thinking about the list first and then figuring out where they fit in the list, you get your sort of impression, and then you go back to the list, make sure you're not missing something.
Gotcha.
So rather than the list coming first, the list comes second.
I have a question. I was walking in my neighborhood, and I was walking in like high bushes and stuff, and I thought to myself,
high tight jeans,
high tight jeans as fuck, and I was thinking to myself, I better get out of here. I'm gonna get Lyme disease.
Oh, good for you.
Get bitten by a tick. Now,
how gonna get you?
Because I listen to Salistar. How prevalent is Lyme disease in California?
You are more likely to get Rocky Mountain spotted fever, typhus. Let's see, what are the other Tsutsugamushi and there are other tick and flea borne stuff here in Southern California that you'd get before Lyme.
Cool.
But Lyme does exist out here.
Yeah, it fucked up Kathleen Hanna. She has.
It does but there are all these rickettsial diseases. We have lots of them. That's why when I saw the rat explosion in Los Angeles, which I'm curious to know how that's doing now that we're all home, I knew there'd be typhus. Because that always comes in.
We have a vaccine for that, though.
No, that's no.
Typhoid.
Typhoid. We have a vaccine. Typhus. Typhoid is a bacterial thing. Typhus is a rickettsial disease, which is sort of not even really a bacteria. It's like almost like a parasite. Good times. My son got typhus. It was terrible.
What?
It's horrible.
When
he was like 10, 11.
Just like fucking around outside and doing stuff boys do. Great.
Yep.
Cool.
All right, TikTok, take me away.
Hey, Nookie Monster here. Tonight only, all mustache rides, $15.
Nookie.
What? Oh, no mustache. All rides are free tonight.
His name is Nookie Monster?
He's the Nookie Monster. He's on the talk, and he likes to throw out sexual suggestions. And actually, his real name is @MichaelCooper969.
Of course.
So he's doing the old mustache rides joke. I'm noticing there's not a lot of teeth in that head.
Bad times.
Bad times with meth?
Cool guy.
He's a cool guy.
It's a cool guy. Teeth is a cool guy threshold, right? I mean, there could be a lot of things up in that category. But I'm just looking at him thinking he's like Joe Cocker meets...
A Ramon? He's got the Ramon haircut.
like Joe Cocker meets a Joey Ramone.
The knuckle tats. That's a sign of
And these have got rings on there.
drugs.
What is it? What is it? Rings tattooed on it?
I always think
what that
knuckle
is.
tats are another sign of obviously like drugs, right?
Yeah.
I do like them though.
Ooh,
this
no.
one's dope.
Oh no.
Look how great this one is.
Oh no.
This is in the Ukraine somewhere. This is my tribe.
Is that a male? An adult male?
Well, three teenage,
and
males.
the one is cellophaned in? He's
I mean, look.
I think we're going to come to a point in the world, maybe post-COVID, where Ukrainian folk become elevated in our consciousness.
Why is that? Because they're so resilient?
They're so crazy. So
Yeah.
much stuff.
Yeah.
And they are resilient and they're tough.
Yeah.
Too, they're
Well,
tough.
I have a pen pal in Kiev right now, and there's fires going on, and
I know. What was it? Somebody said that the Chernobyl one got on fire.
They're
What the
afraid
hell?
of Chernobyl being set on fire. She said that they've luckily curtailed the fires
What
around
kind of
there.
fires? Like wildfires? Like
Yeah, out in the, I don't know, near it. So, but the
In the
smoke is
woods.
blowing into the city, and so the city is just covered in smoke right
I
now,
see.
and people are evacuating.
I mean, Kiev's
but
a big city, right?
Kiev's major. Yeah.
You and I got to go because it's my heritage too.
Nope.
Come on.
Fuck that.
With your dad.
No.
Yes.
I'm not going.
Come
no,
on.
Nowhere near that
would
region.
Be,
No.
That would be
Couldn't pay me
internet
enough.
gold.
Couldn't pay me enough.
Why?
To go to Russia and that whole Ukraine? No fucking way. They kidnap us.
Probably true.
Yeah.
We could learn how to speak a little Russian from Bert. We could say we're the machine. All
Well,
right,
this
let's go
guy's
on.
sweet.
This looks like another Norman type.
I am so sad. I have no one to be gay with.
Oh, that
That
is
one's
sad.
kind of a sweet.
Yeah, I do feel sad for him.
Yeah.
But see, there's a Norman-esque quality to that guy, right? Now, if you were out in the world and you met that guy and Norman in their professional attire, you wouldn't really be able to differentiate, right?
I know.
Right. So
That's the thing about
just think
that
about that
world.
as you go in the world.
Oh, I
think
worked-
about that as you're out in the
One
world.
time I worked at a company. I was a paralegal, and the HR lady took me out for lunch, and she goes, I'm really bummed today. My dom broke up with me.
Oh.
What? And she was straight-laced. You never know. This one's
what
my
are you-
fucking
what are you
favorite.
doing?
This
what are
one's
you doing?
What with my life? This one made me so happy. I laughed at this to myself for days.
Oh my God.
Is she alive? Festival or two, you've got me on
Excuse
board.
me?
That would be on board a flight
Excuse
to
me?
the airport in Traverse City.
But that's what a dead person looks like.
I know. I'm thinking.
So
How many times have you worked with the elderly and you thought they were dead, and then you had to
it's
tap
a
them?
routine thing for staff and or me to come in the room together and go, find out if she's breathing, check it out, and then we actually before you do it, you go, does she have a directive? Does she have a directive? What are we going to do here? Why is that funny?
I don't know. It's so dark because it's so morbid. Like that's how everybody ends, just in some
Right.
fucking home. And
See, I'm hoping that this COVID thing helps us think about those things. So if you don't want to do that, you like set it down in paper in writing what you want.
oh, you mean
Do you
like
not want to be a nursing home? Do you not want a feeding tube? Do you not want people pounding on your chest?
fuck all that?
Back in my day when I was doing a lot of this kind of work, after 85, we really like please think about this because your probability of living months more miserable
Yeah, I
is
don't
about
want
all
it.
we got here.
Just wrap me up and throw me in the L.A. River.
Right, so people need to think about that.
Let gangbangers shoot at my body.
what do we got here?
Oh, this chick's the best, dude.
Okay, so I have a long history of constipation and whatnot, and I've had to get stuff removed out of me from the hospital. It's
Oh, yeah,
gotten so
I've done
bad.
that. I've done
But
that.
I'll tell you what, cigarettes have laxatives in them.
That's true. She's right, so it's
And
coffee.
it seems like every time I smoke a cigarette, I have to take a shit.
Okay.
And I'm going to tell you what, man. Taking a shit is like a relaxing experience. No wonder people got so much fucking toilet paper, because when you're lonely, you're in
She just dropped the cigarette.
Damn it, I dropped my cigarette.
Why is
picked
she
it right back up.
Why is she lonely? She should have a team of men after her.
She's amazing.
She's the best. She's the best.
Dude, I would seriously hang out with her. I like her.
I have trouble kind of seeing her because she's so white trash. She's fucking translucent. I can see right through her.
She is 100% authentic American trailer trash.
Look at the trailer with the slats behind
Bro,
her. Oh, I love
she's
her.
the
Love her.
best.
Now, again,
Go ahead.
whoever she is, peace and love. We actually love her.
Love.
Translucent or not.
Yeah.
It's just everything.
She's rad. Okay, but we got knuckle tats. Did you notice the anarchy tattoo on the top of the hand?
I saw the tat. I didn't see what they said.
Oh, well, one is the anarchy symbol on the top of the hand.
The other looks like brass knuckles or something.
Yeah, and then she's got neck tattoos as well.
Oh, yeah, but look how they do them. That men do it across the trachea.
Yes, that's so vulnerable.
That's I'm a criminal part.
That's signaling like I would tattoo over the most vulnerable part.
Women on the side of the neck do either stars or like Osiris symbols from Egyptian. Right?
Okay, somebody right now, can you Photoshop Dr. Drew covered in neck tats? And
look, she has Osiris on the side.
Oh, you're right.
That's exactly what I said. That's exactly what I said.
Can we have a ding 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 every time Dr. Drew called? We need a sound effect of a ding ding ding.
There is no male
whenever
necktie.
he gets it right.
No nail neck tat that includes an Egyptian symbol of Osiris.
That's a very feminine
Yes,
choice. The
right.
guys go for what? Barbed wire? I don't know.
To me, it always looks like their trachea is tattooed on their trachea. It always looks something like
oh
scaly.
Gosh, it's so painful.
Yeah. Beyond. Well, I love her. Do we have more with her?
But let's talk about the science. So it is correct medically. You're saying that she went to med school and she discovered that
nicotine.
smoking.
She could do other things than smoking. She could just take snuff or something. She could do nicotine another way. There's a way to do nicotine that is safe.
Is there?
Nicotine lozenges, nicotine gum.
Okay.
She could do that instead of smoking a cigarette.
Damaging her lungs.
But then I would see her because she wouldn't be so translucent white trash.
So white. So that is a laxative, and as is coffee. Now, why does coffee make you shit?
It's a stimulant.
Hey,
coffee's not actually a stimulant, if I remember right. It's actually an adenosine blocker, so it's sort of it takes off the brakes. It's not an actual stimulator like, say, meth or nicotine.
It just lets your natural freak show.
It sort of pulls up some of the down regulation.
It's interesting.
Yeah.
Wow.
I'm having so much fun. I'm so glad we did this. Let's take a couple more calls, shall we?
That's what life is really about.
Okay, let's see here. I've got lots of good ones. Ooh, I like this one. Courtney, what's going on there?
Hey, how's it going, guys?
We're good. We're wearing
jeans.
Hi, jeans. Mommy.
So I had a quick question. So my dad is an alcoholic, and we don't have the greatest relationship.
Does he have a Ukrainian accent?
Wait, does he wear Adidas tracksuits and gold chains? Does he play tennis drunk?
No, I wish. That would make it more interesting.
Will you please put that on TikTok? Will you please restore your relationship with your dad?
He won't do it. He has no sense of humor about himself.
I know, but you can
get him.
Mm-hmm.
Fuck, I know.
Yeah,
I know, at least for the comedy.
Let me just go with you.
I know. I don't know where he is. He's in Vietnam.
What? Oh, yeah, his girlfriend.
Yeah, no, wife.
Wife.
Fourth wife.
Okay, Courtney, sorry. Go ahead. Dad's an alcoholic. Yeah.
Yeah, so my dad's an alcoholic. We don't have the greatest relationship. I was supposed to get married this coming weekend, actually, but with everything happening, we had to move it to August.
Okay.
So I'm kind of struggling with, do I have him walk me down the aisle? Do we do a father-daughter dance?
These are I love these questions. Before I jump in, Miss P.
I mean, you don't have a good relationship with him. That's what you opened with?
Did your dad walk you down the aisle?
He did.
How was that?
Okay, let me put it this way. During the rehearsal, when you rehearse the wedding stuff, I was standing with him. We were going to go to the altar, do the practice walk. And I go, oh my God, Dad, I hope I don't cry tomorrow during the real thing. He goes, why would you cry? So, and then he also was having massive fights with my now ex-stepmother during my wedding. So it was like
ex-stepmother,
like they were still married at the time, and they fought the entire week. So it became about him and my stepmom.
Right,
so he made it about him.
Of course.
I mean, look, it really is a matter of, a lot of people put sacred shit on family. Just because someone's blood related doesn't mean they need to do anything with you. If you don't want him there, he doesn't have to be there.
So that's an opinion.
Right. Yeah.
I'm going to restore.
The hard thing is my parents are happily married. Like, they get along great now.
Yeah. So here's the deal.
We live in a small town, so
So-
there's a lot of, like, I don't think a lot of people know that he's an alcoholic, so I don't want to raise those questions and, you know, put them in a bad spot where people are like, hey, why aren't you doing a father-daughter date? Why didn't your dad walk you down the
let's
aisle?
break it down. Let's break it down. Has he been abusive to you when he's been drinking?
Emotionally, he's never been physically abusive at all.
Okay.
But when he's-
That's all right. That's plenty.
Yeah,
and
it's
have you
enough.
ever discussed that with him, confronted him about that material, anything?
Oh, yeah.
Okay.
I'm the one who's been very vocal
Okay.
about it, you know, all growing up.
Okay, so hold on. Let's just answer the questions. And has he ever tried to get sober?
He's done it a couple times cold turkey, but it never lasts more than
And he's
6
never
months.
gone to 12-step or anything of that sort?
No.
Could you ask him as a condition, it's just a question, of walking you down the aisle to be a few weeks sober before we do it?
I have thought about that. I feel like maybe if I give him the option to not drink during the day, it's either going to be like, great, he's not going to drink, or he's going to get offended. And he's not a big fan of the whole, like, me as his daughter telling him what to do as a dad. He's not
I get it.
comfortable with that.
I understand.
dynamic.
I get that, but it is your day and it is your choice, and you may need to set, if you're feeling this way. I mean, I think it's also, I think Christina's position is fine. I will propose a completely alternative point of view, which is let him do it. It's who he is. Why get into this now in the middle of your wedding? It's the last thing you want to do.
Right.
You know, you want to have your dad there. He is who he is. Hopefully he'll get sober someday. Your parents are happily married. God bless them.
Well, here's what I would say.
Baruch Hashah.
If you go Drew's route, I would suggest you just keep your expectations at a certain level.
Low.
Expect him to act a
Right.
fool. Expect him to say messed up stuff to you. Expect him to ruin your day. That's what I'm saying.
So
If
you have three
invite him-
choices. You have
Yeah.
three choices, and the three choices are, it's who he is, let it go, let it fly, get ready.
Let it ruin your day. Go
the
ahead.
other thing is, no, sorry, I'm not up for it. And the other is, hey man, if we're going to do this, I have certain things I like you to do, and it's not for you, for me. I need to know that this day is going to go right.
Yes.
And in the past, I'm sure, I hope your position has been like, hey man, I worry about you. You're going to die of alcoholism. You know.
Yeah.
I wish you'd get sober. I wish you. Now it's like, no, you can do as you please. But if you're going to be in my wedding,
Right.
Yeah.
here's what I need. Okay?
Right.
Good
That
luck.
totally- that
Good
makes
luck.
sense.
Let us know how it turns out, all right?
you.
Okay. You got it.
Will do. Thanks.
All right.
That sucks.
And just keep your jeans high and tight. It'll be fine.
Yeah, just make sure your dress is tight. Yeah, it sucks to have to put down boundaries for your own parents to come to like your wedding. It's sad. It sucks. It sucks.
You know, my
for
daughter
her.
and I are writing a book about this.
About boundaries with your folks?
About consent and boundaries and things, and it's been a really interesting experience. And we got to a place where if you have compassion for the other person, it really helps.
Yeah.
You know what I mean? If you are like, that's what kind of was encouraging her. It's like, that's who he is. It's what he's gonna live his life as he lives it, and then you decide what you need to do.
Right, but that's why I say to her, if you know who he is and you accept him as he
You don't
is, then it's
accept
your
it.
but it's your choice to go, hey, come over and ruin my shit.
If
or don't
that's
ruin my
a
shit.
potential, he was that kind of drunk.
He's gonna ruin her shit because he's gonna be in her head. Trust me, child of alcoholic. Who was an alcoholic? Was your dad an alcoholic too?
No, I think my mom was a dry drunk though. I suspect.
Oh.
Eric, what's going on?
Hey, Dr. Drew, how you doing?
Good. What's up, buddy?
So I had a question about Propecia, specifically loss of erection, after taking it about a year ago, and I was on it for like 3 months.
Yep.
I was wondering if you had advice to be able to take it and not lose that.
So
that I
you
can
so
keep
so you
feathering
regained
it, so to speak.
Yeah. So you regained your ability to have erection after you got off the Propecia, right?
Yeah, exactly.
Was there also a drop in your sex drive while you were on the Propecia?
Yeah, but it was yeah, I would say there was, but it's tough to know what was just I don't know, just me tricking myself.
Okay. And would you say you're back to normal now?
Yeah, I would.
All right.
But I guess my hesitation is to get back on. And
here's my problem with Propecia, and I've had to call. Propecia works. It's a hair, prevents the baldness. May have an influence on prostate cancer too. May reduce the risk of that a little bit, but it does in many men reduce their erectile function and their sex drive. And in about, I think it's like 15 or 20%, it becomes permanent. So that's why I worry about Propecia, especially if you're very sensitive to it like you are. Why don't you just switch over to Rogaine, do that kind of thing?
Okay.
All right.
You don't have any advice on bootleg treatment or anything?
That is well. I mean, Rogaine.
Black market.
No. Anything that works is going to have physiological effects and be, have side effects. That's just the way it is.
Oh, may I put sorry, I'm back to this chick on her wedding. A great thing to do for people when you don't want them to come to your wedding is have a destination wedding, at least a 2-planer. And that'll deter a lot of douchebags.
Well, this is back to Erin, whatever her name is.
Yeah, I'm still on her in my mind.
Yeah,
in my heart.
You've taken this one hard.
Yeah,
You're
it's
having
very
a
personal
PTSD.
because I had to deal with this with my messed up family members. If you do it somewhere far away, then it bypasses so much drama.
And Eric, if you email me at drdrew.com, there's a whole, you're in Texas, but there may be a little network of people doing other kinds of hair loss kind of interventions. I did interview a guy on my podcast once that I was persuaded is kind of working. So email me there. I'll try to get you that information, okay? And attention.
Thank you, Doctor. Thank you, Christina.
Hey, attention, Susan Pinsky, because she's the one culling through all that stuff.
Tom was like, fuck it. I'm just going to go bald. He wants
his
boners. He doesn't care. Tom does not care.
But it's so great that we live in a time when you can just have short hair.
I know.
I was
to lose your hair. I can't even imagine.
I just think now it's just a style. It's just no big deal.
No, that's true.
It's just who you are, man.
You're so lucky. Look at you.
I know it's weird. I got
plumage,
so much damn hair.
Beautiful silver hair.
Yeah, but thin, super thin hair. Come on now. Let's see. We have time for one more call. And let's see. This is Claire. I think this one's gonna be hard. Claire, go ahead. Claire.
Hello.
Hey there.
Hello. Hi.
Hi.
Oh my goodness, so great to be on. So I had a quick question, but it requires some setup. So I basically met someone off a dating app recently, and I kind of going into it didn't really expect much. And let's see. So we basically met up to hook up, and I was not interested in this guy because he's kind of a cokehead, I found out. So I was like, I'm going to stay out of this. But as we kept talking, we were starting to hit it off, and it was going really well. And then he kind of just fell off, went completely MIA, and I didn't hear from him at all. And I found out he was actually forced to go to rehab, an inpatient rehab.
That always goes well.
And so I know that part of that is that you're not supposed to have contact with potential relationships and partners and stuff, but I was just kind of wondering what I should expect in terms of how to talk to him and
Claire, the best thing the best thing for him, do you want to have a relationship with him?
I think so. Yeah.
He is not supposed to have a new relationship for a year. He's not supposed to change anything for a year. And so if you really are actually concerned about him, your whole point of view should be focus on your sobriety, nothing else. Go to sober living or wherever he needs to go. If he's new relationships, which will be that will be what he thinks is a good idea. He'll immediately jump into a relationship. That's what addicts do when they're in recovery. They're trying to feel better, and he's using you as a life preserver, and you will end up being an anvil.
I've seen that on Euphoria, season 1. You got to watch that show if you want to get into a relationship with an addict. And furthermore, shouldn't we recommend that Claire see a therapist? I mean, what's the attraction to wanting to be with someone who's emotionally unavailable? Claire, what are you doing?
Yes,
Fuck this guy. What's wrong with you, man?
I want what I can't have.
See, it feels kind of more like that.
Go to therapy.
It feels a little weird. This is,
Just fun?
Yeah, just
This guy's going to ruin your life, Claire. Run.
Well,
Let him
more
clean
importantly,
him.
he has a serious illness, and you're going to ruin his.
Yeah,
not
boo-boo.
intentionally, but just the way this works. If in a year he's sober and you want to have a relationship with him, go on.
Yeah,
beautiful.
Sober though.
But give it a year, and he's got to been in the program, really working his program and getting better, that kind of stuff. This was a fun show, starting with pigs, ending with rehab. Aren't you proud?
I love it. I love the depths. Hey, it's Dr. Drew After Dark. It's dark as shit, and I love it. I love it. Don't you love the dark side of the force? Just admit it.
No, well, no.
You're into it.
You take me to the dark side of the force. That is your goal. Thank you for taking me there.
Oh,
and then once you get me there,
please.
Tom just ruins me.
And then he walks you through the pasture.
And then he just goes, good job, good job, good job.
That's what I said. Yes.
The whole way.
Yes.
And so I hope you're proud of yourself.
I've always.
Okay.
Proud of myself.
And but it has been fun. It has been a nice palate cleanser from
you're
all
the
the COVID
best.
stuff, and I appreciate it. And we'll take a little couple-day break here. We'll see you guys on the next episode.
All right, man.
Thank you so much. See you then. Keep them high and tight.
All conversations and information exchanged during participation in the Dr. Drew After Dark podcast or interaction on the drdrew.com website is intended for educational and entertainment purposes only. Do not confuse this with treatment or physician medical advice or direction per se. You must always follow your medical professional's advice and direction. Nothing on these podcasts or posted on this site supplements or supersedes the relationship and direction of your medical caretakers. Please understand, I am not playing the role of physician in this environment per se. I'm educating. I am a licensed physician with specialty boards in American Board of Internal Medicine and American Board of Addiction Medicine.